Hi, I'm Jamie Whincup and welcome to B Street Smart Online. In this series, we're looking at how being distracted whilst driving can have devastating consequences on young people. Statistics show that P-plate drivers are involved in more crashes than any other driving group. I say crashes as it's very rare that a crash is an accident. There's always something or someone that causes it. During the B Street Smart Online series, we're looking at what we can do to reduce these statistics, and we're also looking at the consequences that these crashes have on the driver, their victims, and also their families. Today we're going to talk about what some people consider to be a very sensitive topic, organ donation. Now you may wonder how organ donation relates to car crashes. To answer this question, please welcome Nicola Dykes, who is a clinical nurse consultant for organ and tissue donation for Western Sydney Local Health District. Welcome, Nicola.
Thank you.
Well, let's tackle this difficult topic. Nicola, before we get to the tweets that the students have sent in, tell us a little bit about what you do and organ donation in general.
Jamie, organ donation is a medical procedure that happens when after someone has died, they can donate their organs, which are transplanted into somebody who is extremely ill or dying. And it gives them an opportunity to save their lives and make a very, very big difference to their lives. Tissue donation also occurs after we die, and in this instance, it has a very big effect on changing that person's life and how they live from day to day. My role in organ donation is actually supporting the families, the staff within the hospitals, and the deceased to ensure that that person's wishes, which hopefully they've made during their lifetime, is fulfilled. It's an extraordinary job. It's extremely humbling, and I feel very privileged to be able to have taken on this role for so many years. I get to meet people that are absolutely extraordinary in times which are extremely sad.
I understand that it's a personal choice to be an organ donor, but there can sometimes be religious concerns. Do religions support organ donation?
Jamie, that's a really common question that we actually get asked, and the actual facts around that is that most religions support organ donation. I think it's an area where if you've got concerns at all, my advice is to go to your spiritual advisor or your religious advisor. But I have to tell you, the information that's available on the Donate Life website provides exhaustive amounts of information, not just on religion, but also specific languages and cultural groups. And in fact, Donate Life actually had a campaign, and what they did basically was gain statements of support from significant religious leaders within Australia across different religions, such as Buddhist, such as Catholic, such as Greek Orthodox. And I really strongly advise people to go to the website and have a look, because the information is really, really thorough and good.
Yeah, good. I wouldn't mind doing a bit of myth busting on organ donation. We've gone out and asked some questions about organ donations, and here are some of what the students have come in with. Let's start with this one. I've heard that if you're an organ donor, they will turn off your machines early because they need your organs. Is this true? How would you respond to that?
Yeah, definitely not. I've done this role now for so many years, and there's no way, Jamie, that I could actually support families or staff within the hospital if I knew that was the case. The strongest evidence in giving you an answer to this particular question is the B Street Smart crash scenario. I think that provides the most evidence in demonstrating to us that the emergency service health professionals, the health professionals within the hospital, do everything they can possibly do to save lives. That is at the primary forefront of everybody's mind. Organ donation, however, comes into play in end-of-life care. So it's not until such time as every avenue's been exhausted to save someone's life is organ donation offered. Sadly, crashes from motor vehicle accidents does result in death sometimes. And in those instances, we have the opportunity to do something good in life, generous, compassionate giving, and that is organ donation.
Here's another tweet. Don't you just sign the back of your driver's licence to become an organ donor?
Well, that used to be the case, Jamie, years ago, but today we have a national organ donor registry called the Australian Organ Donor Register, where everybody goes to register what they would like after death in regards to organ and tissue donation. It's a really simple process, and the options are available, suits everybody's needs. Those that like to go online and fill in an application form can do so, or you can receive a paper version, which I kind of like because it's prepaid postage, from your local Medicare, or you can actually download a printable form from the internet and fill it in if you don't want to actually go online. Now, this might be a little bit cheeky, Jamie, but are you a donor?
I'm actually not sure. Can we get online and give it a go now?
I reckon we should.
Is that cool?
We should show everyone how easy and simple it is.
So to get to this screen, what do I Google search?
I think the simplest way, just to Google search the Australian Organ Donor Registry.
Yep, perfect. Righto, so fill in my details. Actually, I don't have a Medicare number at the moment. Is that fine?
Yep, that's fine. You can still register what you would like without having your Medicare card number.
Perfect, and there's a bit of a wish list down the bottom there. Things like bone tissue, is that important?
Yeah, there's a lot of things on that list. I think people aren't really aware of what you can actually donate and how it helps somebody. Yeah, and as you said, you can definitely select all, or you can actually go through and select individual organs and tissues.
Yep.
But bone tissue, for example, is an incredible thing to donate. Some of us might be aware of Elisa Camplin, our Olympic skier. She actually received a donated tendon from someone who died.
Yeah, right.
And that surgery meant that she can continue on in her sport, which is incredible, and her profession, of course.
Yeah, awesome. Lungs?
Yeah, lungs are a pretty incredible thing to donate as well. Generally speaking, they can be transplanted as a whole, or in some cases you can actually split the lungs and help out two recipients.
Yeah, good.
Similar to the liver, Jamie. The liver's an incredible organ.
Yep.
And if you're really, really well, fit and healthy, great medical history
Yep.
at the time of your death, then you can actually, in some instances, with the technology that they have, the surgeons can actually split the liver.
Wow.
And give the smaller part to a little person and the larger part to a bigger person, which once again means you're helping two people.
Yeah, amazing. So I'm going to tick all, just because I'm a good guy. Confirm my personal details, and then hit register. That was easy.
Simple.
Simple. So back to our tweets, the final one. Do you have to be 18 to register? What if I'm younger than 18? Can I still do it?
Everyone can register on the Australian Organ Donor Register if you're over the age of 16. So that makes it really easy for that age group. What can you do if you're younger than 16? Well, first and foremost, tell your family, talk about it, let them know, because it makes a massive difference at the time if that conversation is had before. But there's other stuff that we can do if we're not over the age of 16 and able to formally register. There is currently a campaign run by Donate Life using the hashtag handle of End the Wait, encouraging everybody, particularly young people, to use their social media, get online to the Donate Life website, pick an image, put their message on it, and get their message out there, encourage their family and friends to the challenge of thinking about it, making a decision about organ donation. So if you're under the age of 16, you can still do stuff to be a hero.
Yeah. I think people don't realise that there are so many waiting for organs in order to live, and it could change a family's life. I know that people also think that there must be lots of organs to donate, but Nicola, that's not really the case, is it?
No, it's not. And the common myth out there for all of us is that when I die, I can become an organ donor, but that's not the case. If we have a look at the scenario with Gracie in the crash scene for B Street Smart, it's very clear in that instance, obviously, that she's deceased and that the narrator tells us that she can be a tissue donor after her death. Organs can only be transplanted into somebody else if they're going to work in somebody else, if they function. In the scenario with Gracie at the side of the road, by the time we get her back to the hospital and retrieve organs, they've been far too long without oxygen and they will not function in someone else. So to actually become an organ donor, it's very specific. Your death or impending death has to be in a situation where you're in a hospital and actually quite specifically in an intensive care environment. All of us, though, on the other hand, like Gracie, have heaps more of an opportunity to donate our tissues. Tissues are slightly different in the fact that they survive much better with less oxygen. And when we die, the tissues can actually be retrieved up to 24 hours after our blood stops pumping around the body. That's why many more of us can become tissue donors.
Yeah, interesting.
Yeah.
How can we find out more information about organ donation?
I would highly recommend that everybody go to the Donate Life website, www.donatelife.gov.au. It's an extremely comprehensive website, and there's heaps of resources up there, particularly if you're a kid at school, a teenager at school, wanting to do projects, speeches, through to all the cultural, linguistic and religious stuff on there. So I highly recommend people to go there and have a look.
Yeah. I think we've got a short video about Mitchell's story and about how his family made the decision to donate his organs after his death. Let's take a look at that now.
My little brother Mitchell was 18 when he died in a car accident. They believe he swerved to miss something on the road, and his passenger side hit the tree of his ute. He knocked his head when that happened, so the first I knew about it was a knock on the door from the police to say that it airlifted him. He had injuries to his brain that he wasn't going to survive. They sort of gave us a few minutes to absorb all that information, and then a different doctor came in and said to us that, had we thought about organ donation and would we be willing. We sort of sat down all as a family and discussed it and said that we would. That sort of started the long ball rolling, so to speak. Mitchell was our best mate and the best brother anyone could ask for. He loved to try most new things, however his passion was dirt bike riding and footy. Even though it was only just summer, he was already talking about the footy pre-season and how many AFL games he'd get to in the up and coming season. Hence why we're here at the MCG today, to get the message out there that young kids, you never think it's going to happen to you, but we're living proof that it can. You need to know what your family's wishes are. I suppose to young kids, in terms of our message to them would be, don't be scared to discuss it with your parents. Like if your parents don't bring it up with you, you bring it up with them. You need to, speak to your mates.
It's not something you really talk about when you're hanging out with your friends and your mates and stuff like that, but unfortunately it can happen.
At the end of the day, it's the family that have the say, so you need to have that discussion with your family. It was easier for us because Mitchell wanted to be an ambulance officer, so although it was a very hard decision for a family to make because you've just been told your loved one's not going to live, it's also easy if you know what your loved one's wishes are, because ultimately they can help save, so many more lives. When we've been in our worst grief, it's helped us to know that because of Mitchell's ultimate gift, he has been able to help 4 other people.
That's pretty hard to watch. Pretty hard to watch. I suppose it's something you deal with fairly often in your job, I could imagine. It really does show how young people should talk to their families about their wishes, doesn't it?
Absolutely, absolutely, Jamie. And hand on heart, that is the core of my role. And the difficulty or the burden more so on the family as such, if that conversation hasn't been had before, or put it in the other hand, if that conversation has been had, the families don't even have to think about it. It's always going to be a yes, and the time that we're speaking with them is extremely stressful and a lot of grief. So not having to think about it with that decision made prior is huge, and they can walk away in comfort knowing that they're fulfilling the wishes of the person that has died or is about to die, and hopefully in the long term get a lot of comfort and feel very proud that their relative has been able to help somebody else.
Yeah. Thanks, Nicola, for giving us so much to think about on this sensitive subject. Please thank Nicola.
You're welcome.
On our next episode, we'll meet the mother of a young woman who tragically lost her life in a car crash. We'll find out the impact it's had on her family and also her friends. Before we go, I'd like to thank Woolworths Petrol for supporting us and being our presenting partners. For further information, please check out B Street Smart online website. Thanks for joining us again today for this episode of B Street Smart Online. We look forward to seeing you next time.